Hello, my viewers and my listeners. I'm so happy that you're listening to me once again. My name is Dr. Sarah Muchai. I'm a counseling psychologist and I'm the founder and the director of Hope and Live organization. We celebrate you as caregivers because one of the roles is to support you, to enrich you, and to uplift you. And so I've come to you because I know you are worth living. You are doing such an important role that I celebrate you every day. And so I come to you, if you are there at your home, if you are there at the care facility, or even if you are at the hospital, you are so important. Maybe you've stayed for a month in hospital of that recipient of care, of that patient, and nobody has come even to visit you. And even when they visit you, they don't remember you. They only take care of the patient. They only think about whom you're taking care of, but they never imagine that you're going through even also emotional fatigue. You're going through burnout. You're feeling psychologically stressed, and maybe you're also feeling strained physically. I know it is not easy. You've been lifting that person. You've been trying to put them on the basin. You've been changing them, and it's not easy. But I pray that God will give you strength. And because I've gone through this journey, I know it's not easy. I've not seen anyone come to see me and tell me, I want to help you for a day as you take care of your daughter. My daughter Shiro, my beautiful girl daughter Shiro, who is 26 years. I've not seen anyone come to tell me, I want to help you so that you may go to the market, or so that you may go even for a visit. I have done it all alone with my family members. So I know what you're going through. It may not be easy. It may not be something to like or even to wish to be in all the days. It's something that you would wish that the period be shortened. And guess what? For this period to be shortened, there is a role that I feel you and I should pray more. And this is the role of a medical supporter, a person who is taking care of this person medically. You are able to tell which drugs are they taking, so that you will not skip at any one time. So I want to believe that you're doing so much of your duty, or even that responsibility, which is more than a duty to you, just to make sure this person doesn't get the wounds, doesn't get the bed sores. You are such an important person. I'm really happy for you, even to have taken care of that aged baba, that aged mom, who is aging and aging gracefully. And all that they are doing is to depend on you, even for their medical support. So to me, there are three things I would wish that you know. And today I know I can be called a person of three, but I still want to say three is the most important, because there are so many things I would wish to tell you, but three are very key for you to know, even as a medical supporter for that caregiver. I have lived with Shiro for 26 years, and there is one drug she has to take every day, and this is an anticonvulsant drug. And so one of the things that I ever had to do is the willingness to run. I have to know, how do I issue these drugs? The willingness to run is one of the characteristics, or one of the quality that a caregiver should have. You should also know the first aid skills. You need to know when this happens, what should I do? You should be a person who is willing to learn. You should be the person who should know, how do I fix this? How do I put the other? How do I take blood pressure? You need to be a person who is willing to learn. You should be the person who should know how are the temperatures, which are the extreme temperatures for the loved one you're taking care of. So I know there is a lot to do. If you are a person who is taking care of a visually impaired child, you need to know, where do I take this child to school? If this person is one with hearing impairment, you need to know, where do I take this child? So as a person taking care of maybe persons enabled differently, persons who are aging, persons who have been already considered that they are having terminal illnesses, you need to be the person who is willing to learn, a person who is willing to know the routines, and who should know, how do I go about what is expected of me. So that's one thing. The second thing, as a person who is taking care of a loved one, just because they are sick, just because they have a disability, you must learn how to be calm even when there is pressure. You know what pressure is? When things are not working right. You have been told your child has gotten into conversion. How do you behave? Or you see this child all of a sudden appears not to be okay, how do you behave? Or this person, you have given them food, and all the food she has been able to throw it out. She has vomited. How do you behave? These are things that come which you have not even predicted. These are things that have come that you have not imagined. You go to change this person and you find they have really messed themselves up. What do? You need to be very calm. Don't scream. Caregiver, don't scream. Just be patient, be calm. Be a person who is controlled. Self-control should be part of you in a way that you're able to handle this person without them realizing that there is danger. The problem of a person who now looks like they are troubled just because of something happening indifferently when you're taking care of this person who is the recipient of your care. If you, in the event, look like you are worried, in the event you look like there is an emergency, you are likely to make the person receiving the care even also to panic. So you need to know how do you calm yourself. Even when you see the temperatures are extreme, even when you see the pressure has gone to the extreme, how do you behave? You need to be calm. Even when you see all of a sudden the legs have swollen, you go to change this person, you find the stomach has bloated, you need to be calm even under that pressure. That is when you are now able to release grace. You're able to tell the person all is well, even if you're going through this. I'm saying this because I've been through it. I have got this experience. I have known. There are times I've looked at Shiro and I've seen, no, this one is not going to live in the next 1 hour or in the next 1 day. I see trouble. But what do? I contain myself, I control, I am calm, I do what is expected, and I don't allow even the other family members to panic. Because when you panic is also contagious. You're likely to also let others know there is trouble, and maybe you're not able to influence them on how to contain themselves. So you should be calm even as you address this person. The other thing is, as a caregiver, you need to be a good record keeper. Documentation skills are very important. When you are able to record everything that is happening to your loved one as you take care of them, know the different things that are happening daily. Record them. Record the changes. When the doctor comes and tells you, it gives you direction, keep a record of what is happening. If you are taking care of this caregiver and you realize that there is need for them to be to be referred to a hospital, it can only be well done when you have documented. You will only be able to explain it well to the doctor when you have documented it well. You are able to tell them, this is how I saw, these are the changes I've seen, this is what has happened. And that document requires you to at least be, to authenticate it, to be in a position to explain, this happened this way, this happened the other, and so I think my loved one is deteriorating. If it is a person who is maybe like my daughter who is cerebral palsy, you are the person to tell, no, I gave 200 milligrams of Epilim and she was conversing. So how do I change it? I move from this drug, I need a stronger one. So you are now able to explain just because you have documented. You are able to tell even the changes in weight. You are able to tell this person is either decreasing or increasing, and this can only be informed by documentation. So you need those 3 skills that I've mentioned. 1, you should be a person who is willing to learn, a person who is willing to be taught, a person who is also willing to know more things, not just the usual things. You need to know, how do you make a nutritious meal? How do you make a diet that is friendly for this loved one you're taking care of? If they are diabetic, you need to know which food should you give. That means you're a good learner, you're a good person who is able to understand what is required for a particular category of the person you're taking care of. So these things may not be known to everybody. So when you get there, don't be rigid. Desire to know. Seek information. We are in the era of technology. You can search internet. You can also consult with doctors. You can also consult with friends. So be a person who is willing to learn. And we have said the second thing is be calm under pressure. And this is not only for the sake of the person you're taking care of, but also for your sake. so that you don't be in a panic mode. It is healthy, it's going to be helpful for you and also for the family members of that particular person. I imagine you're taking care of a visually impaired child, and now you see something that is really, that can cause harm, and you start screaming. Really, where do you expect this child who is visually impaired to run to? They don't know what is happening, and you are screaming. So you need to be very calm, even in that situation, even in that condition. You control yourself. And thirdly, we have said you should be a person who is able to take records. Take records. Know where there are changes. Know the things that are happening, even to this person that you are taking care of. It is going to be helpful, either you are at home, whether you are at the facility, the care facility, or even you are in hospital. Recording is very important. Doing documentation is very important, very key. So I'm really happy that you're doing a good role. You are just the person I need to celebrate today. I feel that you need to, even if nobody praises you, get it that I have really appreciated the kind of work you're doing, and I'm with you in this journey. I am so glad that you are worth celebrating. And even as you fill the bucket, your bucket with hope, share it with those that you're taking care of. Tell them of the hope that you have. Encourage them. Don't let them be down. Show them there is a future for them. There is a tomorrow. Just as the Bible says in the book of Jeremiah 29 and verse 11, just take it that God has good plans for them. Plans to do them good, and plans to do them good and not evil. Plans to give them a future and a hope. And guess what the Bible says in the book of Jeremiah 30, just the chapter after chapter 29? That even if the wound is incurable, He is able to save you. It doesn't matter the sickness or the things that are so difficult for you. I want to tell you, God is able to take you through. In the life that you're in, God is able to turn your scars into stars. I celebrate you. Thank you so much, and God bless you. Dear caregivers, radiant caregivers, beautiful caregivers, I'm so happy that you've been following us on TikTok. You've been following us on Instagram, you've been following us on Facebook, and you have also been following us in YouTube. You're such an amazing person. If you have any question, if you want to give us any feedback, you want to make any comment, subscribe to our YouTube channel, subscribe to Hope and Live, and you shall find all the information, and we shall have to respond to you in the event you have any questions. We'll be ready to give you feedback. Thank you, and may God bless you.